Mental Health Awareness Month. So without looking and Googling and cheating, maybe put in the chat, what year did we start recognizing Mental Health Awareness Month in the United States?
Guess was going to be whenever we had a brilliant president that had the foresight to think that that was important.
That's
I
another
couldn't,
good
I couldn't
question.
know which year it was.
Yeah, so don't cheat. I'm gonna actually I'll look up who the president was. I will give you a hint. The president was Harry S. Truman,
Ooh,
way back. It was 1949.
wow.
Yeah, and it was first, so it's 76 years ago. If we think about that, I mean, that's pretty amazing.
Yeah.
Of course, it's taken 70, what, two years to get it really to the forefront. But anyway, it was named by the Mental Health America at the time. No, that's what it is now. It was then National Association for Mental Health. You guys probably know more about these industry associations, but yeah. I feel like this really doesn't need any introduction at all, because the two speakers today are near and dear to the coalition's heart and to our community's well-being, for many, many years. So we're going to kick it off with Jennifer Hibbard, who is CEO from Viewpoint Health. She has worked there. Jennifer is at least 19. Is it now 20? Have we clicked another year?
It's going to be 22 in August.
Oh, okay. Well,
Can you believe that? I
I
know.
know. That's
Yeah.
hard. I think importantly, Jen, not only is she a great executive and a leader and, an advocate for mental health in our community, she's also a licensed professional counselor. So she's grounded in this work. And, Viewpoint is integral to supporting mental health services in our community. And so I think I will actually just not continue talking about Jen, but I'm just going to turn it over to her. She's going to give us an update on what she's seeing in our community, what Viewpoint Health is doing to support our community, and we'll go from there.
Great. Thank you so much. And I'm glad that we're recording this. Feel free to share this with
I will.
the whole group and whoever, and you can all share it around. But I'm going to go ahead and share my screen. Can y'all see my presentation now? Is that right?
Yep.
Great.
Can see the full screen.
Great. So I wanted to start off, you went back in time. What was the year that mental health was first?
1949, 76 years ago.
Okay.
Is that right?
Well, I'm going to go back a little further.
Ooh.
I'm going to go back to 1842.
Okay.
Because this was when Georgia, our lovely state, established Central State Hospital in Milledgeville. And at that time, it was called the State Asylum for the Insane. So you can see this picture here. This hospital has, this particular part of the building of this hospital is no longer in use. But this was a really dark time for individuals with mental illness. And this time spanned for 100 years of really institutionalizing and warehousing individuals with mental illness. And not just severe and persistent mental illness, even just depression and anxiety we didn't have the treatment available. We didn't have the understanding or the knowledge of how to support individuals with mental illness. And it really was the only treatment option was a state hospital. And this was not unique to Georgia. This was across the nation. Fast forward to today, we still have 5 state-run hospitals in the state. They're much different now. This is the one that's closest to us in Atlanta. This is Georgia Regional, and it's just right there in Atlanta off of Panthersville Road. We still have Central State Hospital in Milledgeville is still operating a portion of that campus. We have closed a number of other hospitals across the state. Rome was closed, Thomasville was closed, but really the hospital system that we have right now is really trying to be more of a brief intervention and not a lifelong treatment option. Unfortunately, we do still have some individuals who stay in the hospital for extended periods of time, but as our goal is to try to get individuals to be served in the community and to be able to live their life in the community in a way that is much more comfortable and less institutionalized. So although, I'm going to go back one slide, because although the movement to start closing hospitals nationwide happened in the 1960s, it wasn't until the 1990s that Georgia actually created a community solution to help support and serve individuals with mental illness. So there was 30 years of, well, we don't have a hospital, but we really don't have a good community-based treatment option either. So public health was kind of filling the void. Some nonprofits were filling the void, but it was still a real challenge. So in 1994, the Georgia state legislature created community service boards, and we were kind of born out and carved out of public health. So you can see here, Viewpoint serves Gwinnett, Rockdale, and Newton. We're here in this little turquoise part. I'll put my cursor right over here. But there's 22 of us across the state. So every county is covered by some sort of access to a community service board. So talking about mental health hospitals, does anybody on the call know what our nation's largest mental health hospital is today? Just give me some ideas. Y'all can either come off mute or you could put it in the chat. Just what are some of your thoughts about, and this is not just in Georgia, in the nation, which one is the largest mental health hospital? I'm going to have to pull up the chat on my other screen to see if anybody's putting anything in there. Charter, yeah, Charter Peachford is a large hospital. Any other ideas?
Thought it was like LA, maybe.
Yeah, yeah. So when you think of a mental health hospital, some of you might be surprised.
Or I was gonna say so that makes me think, oh, okay.
There it is.
I was gonna say the criminal, see,
I was
like,
gonna
because I was
say-
gonna say
That's
criminal
right.
justice,
I
but
was
you
gonna
said
say veterans.
hospital.
Yeah,
So
well,
that's
Yeah.
why I didn't, if you had said
Right.
mental health provider, I would have said criminal justice system, but you said
Yep.
hospital, so. okay.
Yeah, but these are hospitals. So these Los Angeles County Jail has a mental health hospital in it. And it's the largest, and they only serve the inmates for that jail, but it's the largest. LA County is the largest in the nation. In fact, the top 3 largest are all in criminal justice. County in Chicago and Rikers Island in New York. They're still the top 3 largest. So whenever you had that big gap from the 1960s to the 1990s, where did everybody go? They all ended up in the prison system and in the jail system.
Right. Can I ask a question?
Yeah.
Well, I'm just thinking about our own. So does Gwinnett County Jail have a hospital in it as well?
They have a medical provider
Yeah.
that is contracted, and they have a mental health pod. And
Yep.
they provide those services right there in the jail. Yes, they do. Yeah, they're a mental health provider too.
Okay.
So I'm going to come back and touch on this a little bit more when I start talking about kind of the trends and what we're seeing and how we can have an impact on this. But I first want to talk a little bit about prevalence. So this is 2024 data. We're still seeing, and this has been pretty consistent for the last several years, we're still seeing about 20% of the population has a diagnosable mental health issue. That's consistent in adults or in youth. It's about 20%. And unfortunately, we hit a high in 2022 where we had a record high number of people who died by suicide in 2022, and that was 49,000 people died by suicide, and 1.6 million made an attempt. So this was the highest suicide rate that we have seen. So it was a little over 14% was the suicide rate in 2022. We haven't seen that high since 1942. So it's been a real it's a real struggle. And another alarming component to these statistics here is that 55% of individuals with a diagnosable mental health disorder do not receive treatment. And of those, 28% tried to access treatment but couldn't. Either there was a long wait list, they couldn't get an appointment, they didn't have any health coverage, they didn't have access to a free or affordable health care, or they have coverage and they have a provider, but they can't afford their copay because the copay is really expensive, or they might have gone once and then they don't come back because they can't afford the copay. So access is still an issue. And then also really alarming is suicide is the leading cause of death. It's the #1 cause of death for youth ages 14 to 15. So we really need to be focusing on our kids and the young population to make sure that they've got access to treatment, and that our parents and caregivers are aware. And something that the community can do just right now today is make sure that your household has their firearms secured and locked up and away from access. Because more than half of the kids ages 14 to 15 who die by suicide do so with a firearm. And they're not buying these themselves. They are getting access to the firearm in their community, usually in their home or in their neighborhood. So make sure that your firearms are secured. And there are easy ways to do that. So please make sure you do that and share that information with your community, because that is definitely a way to help prevent that access. So a little bit about behavioral health services in our community. Viewpoint Health offers services. We provide services to individuals who are uninsured. Most of our services are available on a sliding scale. And even if you do have some income, if you are low income and uninsured, more than likely your services will be free. We don't have a copay. Our sliding scale goes all the way to 0. And then we do, based on your income, we do have a sliding scale, but the majority of our individuals can come at low or no cost. Our services are outpatient clinics, we have day programs, we have community-based services. We also have clinicians embedded in our schools, and even with our first responders and our police departments. So this slide here shows one of our co-responder units right here. This is an LCSW, Pej Madave, and his partner, Tracy, who were co-responders together. But we provide services in, as I said, in our clinics and day programs and schools, but also we do have crisis stabilization units. We've got one that serves adults here in Gwinnett. We have an adolescent unit that is open to the whole state, regardless of where you live, that's in Decatur. And we also have a specialized crisis stabilization unit for children with autism, and that's located in Conyers. And we serve the whole state. All of our crisis units serve the whole state. It doesn't matter where you live. We also partner with emergency room, community partners. We also, our community services can be provided in the client's home. We go to you. I do want to talk a little bit about courthouses and jails because we've recently started a program with probate court. So you may or may not know, but as a community member, if you have a loved one or a neighbor who you are really concerned about and you've tried to get them to get access to treatment and they have not followed through, or they have struggled getting access, or they've been unwilling to get treatment, you can actually go, you and one other person, 2 people, can go to the probate court and appeal to the probate judge, and the judge, based on your account, can issue an order to apprehend. And then the police come out and apprehend the individual and bring them to our crisis unit for an assessment. That doesn't mean they're going to have to stay there automatically. We do the assessment and we determine what needs to happen. That can be a very traumatic experience. So something that we have piloted with our probate court here in Gwinnett is an alternative. So instead of writing that order to apprehend, could you alert our clinicians? It's usually somebody from our co-responder team, and we'll go out to the house with a clinician. And the officer will be there too, just in case, but our clinician will really be the one to knock on the door and do the assessment right there in their home versus putting them in the back of the police car and bringing them in. Because a lot of times individuals will be responsive to that if they know that getting into treatment is going to avoid going to the crisis unit or to jail. So let's go ahead and get into treatment that way. And so far, I believe it's like 85% of the people that we have served in this manner have stayed in treatment, which I think is pretty good. It's better than it was whenever we were going the order to apprehend route. So this is just a slide that says no wrong door. We want to be wherever the individuals need us. So if people are coming in through the school or through the ER, through law enforcement or courts, we don't want, our philosophy is we don't want to give somebody a card and a number and tell them to call. We want to go be there where they are to make that assessment and get them enrolled in services in a warm way so that you're not having to just kind of go through the typical medical process of getting an appointment. And then just to talk a little bit about the future of mental health and in particular in Gwinnett County. As I said, we serve Gwinnett, Rockdale, and Newton. That's a population of over 1 million, over 1.2 million. You know, we've got over 1 million just now in Gwinnett. When you bring in Rockdale and Newton, it puts us close to 1.3 million. And so based on the most recent census, the total uninsured population for our 3 counties was 184,000 people. And if you use that prevalence rate for 20% of the population is going to have a mental health issue, that takes us, of the uninsured population, which is really our primary target, that puts us at 36,900 people. We only have 23 crisis beds for all 3 counties. And that means we've got 1 bed for every 1,600 people. So we are very much under, we don't have enough of the resources to go around to have an impact on everybody that would need us. So what are we doing about that? Well, some of you have already heard it in the news. Some of you were at the groundbreaking, but that's like 1.5 years off, and I'm going to talk about that. But first of all, I'm going to share with you these plans. So this part right here, this little building here, is our existing crisis stabilization unit. That's our existing unit with 23 beds. And we do not have a way for somebody to just walk in here. You have to go to the outpatient clinic or you have to go to the emergency department if it's after 5 or on the weekends. And then you have to try to get, you get assessed over there and then you try to get access to one of our 23 beds. What we really want and need is to have this new addition that we're putting on here, which is going to be a crisis service center and a temporary observation unit. So we'll be able to actually bring somebody could walk in here and we can assess and then have a temporary observation unit. It's kind of like a little emergency department where somebody could stay in a space, kind of like in a comfortable reclining type chair for up to 23 hours. And we can do an assessment, we can give them medication, they can see the doctor, the nurse, a counselor. They may or may not get admitted into the crisis unit. They might be able to avoid taking up one of those 23 beds, and we might be able to connect them into services and care without admission. But all of that is going to happen in this new area here, where we'll be able to have a walk-in and up to 6 people at a time comfortably to be in that kind of temporary observation space. So we actually received funding from the federal government in 2023. It was the Consolidated Appropriations Act of 2023. Congresswoman Bordeaux originally helped us, and we had help through her with Matt Yarborough with her when he was working at her office. And then it transitioned over to Congresswoman McBath because of the change. And we're in the process of getting our permits through the city of Lawrenceville and Gwinnett County. And we're hoping to break ground any day now. So this should be built in about 5 or 6 months. And then we'll be able to have this open crisis walk-in center. The next picture is going to show you kind of the furnishings that we have in our existing little spot right now, which is not very warm and safe and welcoming. But this is the furnishings that we have to put in the space for our walk-in center. So it's called the living room model. So it's really meant to be able to come in, have a seat, talk with somebody, and kind of before this, maybe we cannot be admitted at all. If we're having kind of this assessment on the front end and we think about all of the different services that are available, then we can go from there.
Where is this located, Jennifer?
This will be right here. It's on 615 Lawrenceville Swanee Road. So it's right behind the emergency department at Northside Gwinnett.
On the campus,
On
okay.
the back side. So
Backside.
not on the Duluth Highway side, but on the
Mhm.
Lawrenceville Swanee side. We
Mhm.
actually, our little crisis unit shares the red light with the red light intersection with the back entrance to the emergency department.
Okay.
Yep, right there. And we've been there since 2009.
Okay.
But we're gonna hopefully this new building will be on here soon.
Mm-hmm.
And then again, 23 beds is not enough. And even if we expand to have our 6 temporary observation beds with our crisis walk-in, we're already at capacity. This is still not enough. So we are very excited and fortunate that the county commissioners have funded the building of a new building off of Grayson Highway. And this is, we actually already broke ground. We're very excited about this. We're expecting this to be maybe December of 2026, early 2027. We will have this building, which is going to be co-located with Gwinnett County Services as well. So the first floor will be a behavioral health crisis center. And that's where we will take everything that's on Lawrenceville Swanee Road right now, and we will relocate that all over there. We're going to repurpose that building, but we're going to relocate the operations over to this building, and we're going to expand. So we will have 10 temporary observation beds and 30 crisis stabilization unit beds. So we're increasing our capacity. And we'll still have the crisis service center with the walk-in component. It'll be open 24/7. So that will all be on the first floor. The second floor will be our Lawrenceville outpatient clinic. So we're currently located on Gwinnett Drive and Stone Mountain Street. We'll be moving that clinic over here to the second floor, so that we'll all be together in one location. So that's really one stop. Regardless of whether you think you might be in crisis or you might need outpatient services, it's all in one place. And then the third floor is just kind of the half up here. Our administrative offices will be up here. So we'll all be in one place. This will really be the hub for where you go for behavioral health services. And we're so fortunate that the county saw this vision and saw this need and is incorporating this and allowing us to be in this building. And then I want to talk a little bit about the future of behavioral health. We need 24-hour crisis care. We also need evidence-based practices. And care coordination is a huge component of what makes behavioral health more successful. Is if you've got somebody who's coordinating the care, not just with your behavioral health care, but also with your primary care doctors or other specialists. And we really do need to be treating mental health issues just like we treat any other health issues, because mental health is health. It doesn't need to be separate. It really does need to be integrated with overall care. And the way we can do this is a new type of of delivery system for community mental health, and it's called CCBHC. You can see that right here in this little logo, but it's a certified community behavioral health clinic. This is actually a national model. It's been around since 2014, 2015. Most of the states that have incorporated this model have done so through a federal grant through the Substance Abuse and Mental Health Administration, SAMHSA. A lot of changes are going on at SAMHSA. A lot of federal changes are happening and a lot of restructuring around health and human services. So I want to talk a little bit about that because it's very relevant. It changes day by day. But I still believe that the Certified Community Behavioral Health Clinic is the answer for the future of behavioral health care for all of these reasons, because it's 24/7 crisis care, it's coordination with primary care, it's really integrated. There's partnerships with law enforcement, like what we have with our co-responder programs. So that model is a different provider type in Medicaid, and it's a different payment model in Medicaid. That does not exist in Georgia right now, but Georgia is building it. As you can see here, all of these counties are currently working towards becoming a certified community behavioral health clinic. So although there's changes at the federal level, certified community behavioral health clinics and Medicaid are still moving forward. So while there might not be federal grants through SAMHSA in the future to support the development of this work or the expansion of this work, the federal government really does support the states submitting a state plan amendment for their Medicaid programs to incorporate CCBHC. And Georgia is the first state actually, and did this well over a year ago. Georgia submitted a state plan amendment to the Federal Centers for Medicaid and Medicare Services to add CCBHC to the state plan for Medicaid, to create a Medicaid provider type of CCBHC and a payment methodology that is a kind of a bundled service payment methodology to incorporate all of the services that the CCBHC provides. So I'm hopeful that CMS will approve that state plan amendment because it is in line with what the current federal government is wanting states to do. And Georgia really is poised to be a leader when it comes to incorporating CCBHC in their Medicaid plan versus being funded through federal grants. So once that process is in place, viewpoint, so the navy blue counties, and this is Clark County right there in Athens, they're a little ahead of us. They had a grant about a year longer than we did. So they're about a year ahead of us in this process. So hopefully July 1, the navy blue counties will be certified. And then the yellow or gold counties will be right behind that. So we're on track. And as of right now, we still do have our federal grant. We've still got another year of our federal grant to help us continue this work. Finally, I just wanted to remind everybody that 988 is available. It is the National Suicide Prevention and Crisis Line. And in Georgia, it is operated by our Georgia Crisis and Access Line. So even you can also call 988 even if you're not in crisis right at that moment, but you're wanting to get access to care. So 988 is still the number to call. And then here's my contact information, but I am happy to take any questions if we have time for any questions.
Anybody want to come off mute? Ask Jennifer a question. I noted second highest rate that you talked about, Jennifer, was, I can't remember, I didn't write down wait, thought maybe it was a death
In the
rate.
40s,
In
yeah.
yeah, 1942. So then 7 years later, of course, then they have the mental health awareness,
Yeah.
so maybe,
And we didn't even plan that as part of our talk.
I know, I'm just connecting a few dots there.
Yeah.
Well, if you have a question, feel free to throw that in the chat. I don't really see anybody coming off mute. It was really thorough. And we're gonna,
Oh, it's
oh, go,
yeah, I
Tamika.
do have a question. Jennifer, great presentation. I just wanted to ask, I know with the expansions, is it also going to align with the hiring, the human resource part of it as well?
So when you say expansion, you mean when we are relocating in our behavioral health crisis service center?
Yes, and then adding the additional beds.
Yeah, we absolutely need more staff. So part of my job as a CEO is to make sure that I advocate for the operational funding that it's going to take to make that expansion. So I have said that that I'm taking the field of dreams approach, and that if I build it, they will come. So Gwinnett County is building it, and I am advocating for the operational dollars that will take to hire all of the staff, because it's going to take a lot more staff. And then of course, we have major workforce issues when it comes to the skilled staff that we need for the licensed professional counselors and social workers, as well as registered nurses. This is a heavy nursing component. So thank you. Thank you to Jen Wilds, who's also a Viewpoint Health employee, who's putting our career page in there, because we are absolutely recruiting and we'll need to recruit even more. So yes, it's going to be a heavy lift in order to be able to open all of those beds. We're going to need the staff to do it. So if you know any nurses or clinicians who want to do this great work, send them our way.
Will do.
Thank you.
All right, we are gonna, if you have additional questions, put them in the chat. Jen will field them for you, or if we have time at the end, we can come back around. But I want to give enough time to Jessica, who is the CEO for Guide. I'm trying to find my notes. So I can come back up and tell you about her. She is Guide is the county's substance abuse prevention and positive youth development agency. So they're tasked with probably, we look at the number one death rate for 14 to 15-year-olds, which is suicide. This is really the heart, I think, of Jessica and her team's work. And she's been involved with Guide for many, many years. I think she got her start in her career as a volunteer and then as an employee there. But they're really focused on community level change. I mean, they're doing the work day by day, but really focused on systems change as well. And specifically around suicide prevention, underage drinking, prescription drug use, vaping prevention, a huge thing these days, youth development training, youth empowerment and leadership, and then all things that help to create a safe community. So with that, I'm going to let Jessica talk about what she's seeing, the trends that they're seeing, particularly around the youth in our community and mental health. And we're going to learn about Guide. Thanks, Jessica.
Sure. Thank you so much for having us. We are really excited to be a part of this, and I am excited to be on with Jennifer, because we do lots of work together, and the partnership that we have with Viewpoint Health is really important to Gwinnett County because of the ways in which our work definitely intersects. So I'm really excited to be here with y'all. As Renee said, we're Gwinnett County Substance Use Prevention Organization. We were started back in the 80s as a partnership between the Gwinnett County Board of Commissioners and Gwinnett County Public Schools at a point in which the county said, hey, we don't have a problem related to substance use right now, and we don't want to. And so we want to put this organization in place to kind of help keep us on the right path. So we were the first of our kind in the state, and really are only one of only a couple of organizations across Georgia that focus on this in a county specific way in the ways that we do. And our work is all about improving community conditions. So that's through preventing substance use and abuse, promoting positive youth development, and we do a lot of training and capacity building in order to create those safer and healthier communities across Gwinnett and the region. And so I've got some kind of data points for you that kind of lead us to, so what are we doing and what can you do? So according to the 2024 Georgia Student Health Survey, which is the survey that at the time, all of Gwinnett County students, all students across the state take this survey. They can opt in or opt out by parent permission, but take this survey to ask about all different kinds of things, behavioral health stuff and mental health, as well as substance use issues and bullying and school climate and nutrition and physical activity. All different kinds of stuff are included in there. And this is some of the data that really stood out to us last year and really does guide the work that we do. So in 2024, this is Gwinnett County specific, 56.6% of middle school students and 50% of high school students said that they reported feeling depressed. And of those, 4.6% said that they felt that way daily. Our students in Gwinnett, 86% of middle school and 83.5% of high school students reported feeling stressed, and 23.9%, so about a quarter of our students said that they always feel stressed, that there is never a time that they are not feeling stressed. And then we've got 42.2% of middle school and 37.2% of high school who have reported basically having an anxiety attack, feeling fear for no reason, racing heart, difficult breathing, things of that nature. More data. 39.1% of middle school and 36.1% of high school reported experiencing intense anxiety, worries, or fears that got in the way of their daily activities. 30.6 middle school students and 23.3% of high school students reported drastic changes in behavior or personality. And 25.7% of middle school students and 24.5% of high school students reported severe mood swings, causing problems in their relationships. So part of what we always talk about when we're applying for grants and looking for funding to support this work that we do in the mental health space with young people, is that if we were talking about a school system of 1,000 people, then those percentages, while they are large, might not be so concerning. But when we look at a school system the size of Gwinnett County's, and 50% of our high school students are saying that they're feeling depressed, we've got work to do. We've got some stuff going on, because those are the people that are then going to be in our community. Those are the people who are growing up here, and we can also make some correlations. If that's how our high school students are feeling, then what's happening in their homes? How are their parents feeling? How are the other people connected to them feeling? And so we use this data to guide some of the work that we do. Some other important pieces of data are that the Hispanic population is now the ethnic group that is most represented in Gwinnett County Public Schools. Over 34% of our Gwinnett County Public School System students identify as Hispanic, with the highest concentrations, over 50%, in Norcross, Lilburn, Snellville, and Lawrenceville. What makes this relevant to our call today is that high schools and middle schools in those areas have the highest numbers and percentages of suicide attempts in the last 12 months. So there is an increase in that population, and there is a large number, the highest numbers across the school system, of suicide attempts. So there's definite work that needs to be done in that specific community. And finally, I love that Jennifer mentioned this piece, because it's connected to work that we're doing as well, that according to the Georgia Violent Death Reporting System, almost 60% of all the suicides in Gwinnett are by firearms. So there is absolutely some prevention work that can be done, that needs to be done, as it relates to making sure that firearms are secured. So what are we doing? So GUIDE is currently providing lots of training. We have a couple of federal grants and some state funding to provide training in things like youth mental health first aid, question, persuade, refer, which is a suicide prevention training, and counseling on access to lethal means. So those are 3 evidence-based curricula. They're designed by other people. That's not something that we created. We use and teach those curricula with fidelity. Jennifer Wilds from Viewpoint is one of our trainers on some of those, and that's some of the partnership that we have with Viewpoint, is to get some of those trainings out in the community. We train youth development professionals, educators, counselors, administrators, people who are in school buildings, who are in faith communities. We've trained in some parts of these, all of the firefighters in Gwinnett County, a lot of the police officers, sheriff's department, anybody and everybody. The water resources, I believe, in Gwinnett County has been trained, community services staff, anybody and everybody that we can access to get these trainings in their hands. We like to do that. We want to do that. We have funding right now to be able to do that. These things they range from about a 90-minute session to the Youth Mental Health First Aid is a 7-hour-ish training. So it's more of a commitment. But they give our participants the tools that they need to recognize signs of a substance use crisis or a mental health crisis, and the steps for how do you respond? How do we make sure that we are, maintaining ourselves in the right way to respond calmly, to know what resources to connect people to, kind of how to handle this crisis situation, and to get the people that we come in contact with the help that they need. We can offer youth mental health first aid and QPR in Spanish as well. So that's something that when it comes to those communities that I mentioned that are largely Hispanic across Gwinnett, we are really trying to get into those in Spanish to offer those courses to make sure that they're able to access the resources and able to know the same things that other people across Gwinnett are learning by participating in these trainings. We also do a lot of resource sharing. You see the picture there of our wellness workbooks and our pass cards. These are 2 of the things that we have available when we're out in the community at health fairs and events. We give them out as a part of the trainings that we offer. Our wellness workbooks actually take people through just kind of thinking about what are the different types of wellness, ways that you can check in with yourself. There's some self-care, the feelings wheel. So it gives people a chance to really kind of think about it from a wellness and stress management perspective. We have these to give away to anybody in Gwinnett County who wants them for free. So if you have a spot, I'm jumping ahead of myself into the what can you do, but if you've got a place where you can put these out, a waiting room, an office, etc., we're happy to get these out to you. And our pass cards come on this little key ring, and so and they're such a cool resource. They're an evidence-based advice cards for how to respond mindfully to stress. And so it gives you some ideas of like, if this is how you're feeling, here are some ways that you might respond to that. Again, just an excellent resource, kind of putting things in people's hands that give them the tools to respond appropriately to some of those everyday life stresses that if people are equipped, they're less likely to end up in crisis mode. We also have a ton of other resources. I'm gonna drop those in the chat box in just a moment, but the brochure, the Guide to Suicide Prevention, is one of the things that's available as a download on our website, but we also have hard copies that we are always happy to share. Things that others in the community can do are get trained and help us get others trained. If you are in leadership in an organization, whatever you can do to help make sure that your whole staff or your whole organization is trained, and also to build into policies that training is an annual or biannual kind of event is really helpful. At Guide, we've made an annual commitment that all of our staff will be trained in youth mental health first aid and QPR. And that means we're giving up time doing other things to make sure our staff go through these trainings every single year. But it's because just like first aid, you have to get recertified. I don't want people to forget because we get busy, we start doing other things. I want us all to have, kind of that easy access, that muscle memory of what are we looking for? What are signs of crisis? How can I respond? How can I connect people to the right resources? So that our team, wherever they may be, whatever space we're in the community, we're ready to respond to those things. If you've got space that you can donate or you want to host a training, we would love to partner with you to do that. There are some great organizations out there across Gwinnett that have been partnering with us. Amira's been hanging out a lot in Buford. Amira's our director of suicide prevention. She's been hanging out a lot in Buford because there's a great space there where they've said every once a month you can come host a QPR or youth mental health first aid training here. And you can do it for free, and that's part of their kind of give back to the community, and it's a great partnership. So we're always looking for things like that. You can distribute our resources at your sites or your programs. Always happy to put together bags full of resource materials. I'm only today talking about the mental health side of what we do, the suicide prevention side, but we have all kinds of resources on all kinds of substance abuse and use topics. We have these incredible monthly newsletters called the Inspired to Make Healthy Choices newsletters that are available both digitally and in print form. And you can sign up to get those in your email. You can print them out. You can hang them up in your space. We're also happy to bring you some if you would like. So anything that you can do to help us continue to spread the word about the work that we're doing and the resources that exist and help people get trained so that they are better equipped to respond to those things would be appreciated. And so that's my super quick, hey, here's all of the things that we have. Our resources are in the chat box, and I am happy to answer questions, but really just wanted to kind of give you a really quick overview of these are the things that we're doing and the reasons why. As far as the future stuff goes, the things that Jennifer alluded to with the federal changes are absolutely impacting Guide as they are most nonprofits who work in this space. And we're hopeful that the federal funding that we currently receive that is good through the end of September will be renewed, that it will not get cut, and that we're going to be able to continue to do this work. So that's our fingers are crossed that we get to keep the focus on this and to keep doing this work because we know that our community needs it. So thanks for being here.
Thanks, Jessica. Questions for Jessica? While people are thinking, I actually have one. The student health survey, are there any changes that we can expect coming up with that? Or as far as you know, they're going to continue administering that in the state and in Gwinnett?
There have been changes. There currently, the data that they do have is being kept where it is. Typically, it has been released by now. Their mum's the word about what they're doing with the data right now. We've been trying to access it. We use it for our summer program to help communities across the state kind of guide what they design their action plans around, and it's not available. It's usually available in spring. And they're not nobody's given, we're getting the runaround when we try to ask. And I know that DOE has a lot of things going on right now. And so there had been lots of conversation about taking it away, cutting it back, how it might change. And I don't know that there's an absolute answer to that question yet.
Okay. Other questions for Jessica?
I just wanted to comment, I put it in the chat, but a lot of their materials are available in multiple languages. So don't just think Spanish, think
Mhm.
Korean and Chinese, and Jessica can tell you all of them, but they're available in multiple languages. So
And if you look at our stuff and you go, yeah, but it's not available in fill in the blank, and you can help connect us to a translator, we can do that digitally, super easy, or give to somebody else to print. It's the printing that we would need help funding, but we could make it digitally in a different language in a split second if you identified one and could help connect us to a translator.
Shannon.
Well, I just wanted to say a quick announcement, and thank you to both Jessica and Jennifer for the engaging presentations in honor of National Mental Health Awareness Month. Of course, Viewpoint Health as well as Guide are both a part of Resilient Gwinnett, and so I just had to take a moment to also mention Resilient Gwinnett, and wanted to drop into the chat. Those are actually two URLs, one being the evidence-based trainings that are offered by Resilient Gwinnett. And so the first URL will take you to the calendar for the remainder of 2025 and the trainings that are available. But if you see any of those trainings and you're like, I would really love to bring this to my church, to my parent group, to my community group, my place of employment, then absolutely please reach out to us. We would love to be able to assist and support in bringing that training to you. And then certainly not least is the second URL, which for those of you that attended our Becoming a Resilient Gwinnett Summit, you know that we released the trauma-informed toolkit at the end of that summit. And so we're really excited that it is on our website, both in English as well as in Spanish. And so we encourage you all to please access that. And in the next few months, we hope to also be able to release it in Korean, Mandarin, as well as Vietnamese. So it's just an additional resource that is available to you.
Yeah, and just let me say publicly too, thanks to Jessica and Jennifer, and especially Jessica's team that provides many of our trainings, in support of the entire community-wide Resilient Gwinnett initiative. So it's really, we could not do all this on our own. We have partners to execute who are well-trained and experts in the field. I like to think that we're working the resilience, kind of end of things, hopefully to decrease the number of beds that ultimately Viewpoint Health will need, right, to serve those who are victims of trauma and have had difficulty in their lives. But all of us working together to address these issues is really going to help make our community thrive, of course. So I'm think that we will record, and when I get the emails from folks of, oh my gosh, this will be next Monday, they'll be like, oh, the all call. I'll say, send me your email and I will send you the recording. But we did shift it this month because of Memorial Day, and maybe that's a lesson learned for me. So we'll think about the next time. But we do have it documented, which is great. And so thank you, Jennifer and Jessica, for presenting today. And the next all call is back to its regularly scheduled time and date. It's the last Monday of the month. So it's June 30th at 4 p.m. Same sort of same Zoom code. We do it the same all the time. And so mark your calendars and hope that you'll be able to join us then. Are there any other announcements from just the group in general?
This is Celeste Weaver. Sorry, I'm on my bus, but just want to let you all know, reminder about our Health and Wellness Family Festival taking place on June 14th at Glory United Methodist Church in Saleville. It's going to be a great event. We have CareSource coming out with their mobile health unit. GNR Health will be there as well. It's a really great event. So reach out to us if you have any interest in being a vendor, or definitely please share with your clients, because we support physical, mental, emotional, and spiritual wellness. And so we're going to have that represented in multiple forms there. So we're looking forward to being fantastic. So thank you.
Thank you, Celeste. And so just know always that if you have health fairs and activities that are sort of open to the community, we're happy to amplify that in our biweekly newsletters. So you can just send that information to news@gwinnettcoalition.org. And if it aligns with all the things, oh, Jennifer Wilds, please.
Well, I appreciate Celeste talking about that because it reminded me about June 30th, Guide and Recast are hosting a mental wellness event on the lawn in Lawrenceville from 6 to 9. Lots of resources, bounce house, and activities for the young people. I've heard rumors that there will be therapy goats there for everybody's pleasure, and the movie Inside Out 2, and just lots and lots of activities and fun, all about mental wellness resources.
I can verify that we've
know.
paid the goat vendor.
Yes.
So I believe there will be therapy
I think
goats
there are
because
gonna be
I've paid them.
Shannon, it's our chance.
Yes.
We've been talking about goat therapy. Okay.
There you
All right.
go. May 30th.
That's great. That's great.
May 30th on the lawn.
Oh my goodness gracious. All right. We are at time, and thank you all for coming. It's a small but mighty group, and a special thanks again to Jennifer and Jessica, and we will see you the next time.
All right. Thank
All
you
right.
all.
Bye.
Bye-bye.
Well, anyone who's on there, don't forget our 501 Connect event. It's June 11th at 5:30. So there's information in the chat. Thanks, Jesse. All right. Bye, guys.
Bye, y'all.